Hello everyone and welcome to our module on torch infections. The torch infections are a group of infections that are dangerous to the baby if they occur in the mother during pregnancy. So if a mother who is pregnant becomes infected, this can potentially lead to harm to the baby, including abnormalities at birth. And the torch mnemonic gets its name because each of the letters in the word torch stands for one of the infectious agents, and we'll talk about all of these in this video now. The way all these infections work is the mother gets sick during pregnancy and develops characteristic symptoms. The infection is then transmitted across the placenta to the fetus. Now, in many cases, this simply leads to loss of the pregnancy, like a miscarriage or a stillbirth, but in some cases, the baby survives and is born and will have abnormalities at birth, and that's what we'll spend a lot of time talking about in this video because that's what they like to ask you about in the Step 1 exam. We'll start with Toxoplasma gondii, which causes toxoplasmosis. Toxoplasma is a protozoa, and it commonly infects and lives inside of cats, and the cats shed oocysts in their stool, so the mother can get sick if she ingests the oocysts that are in the soil. For example, if she eats contaminated food, or works out in a garden, or changes the cat litter. There are also a lot of animals in nature that are reservoirs for this protozoa, and so if a woman who is pregnant eats meat from a contaminated animal that is undercooked, she can also potentially get an infection. If a mother who is pregnant develops a primary infection with toxoplasma, assuming she is immunocompetent, she will most likely be asymptomatic. 80 to 90% of primary infections are asymptomatic. In a small number of women, there will be nonspecific symptoms like lymphadenopathy, fevers, chills, and sweats. Now, you may be aware that toxoplasma can become latent inside an infected person, but it turns out that a latent infection usually does not infect the fetus, so it's only going to be a primary exposure of a pregnant mother that can potentially lead to harm for the baby. And the diagnosis is with antibody testing. IgM antibodies are positive in the first week after exposure. IgG antibodies peak at about 6 to 8 weeks and fall over the next 2 years. Most newborns who have been exposed to toxoplasma in utero will appear normal at birth, but the classic triad in an infant that does not appear normal at birth is to have hydrocephalus, as is shown in this baby in this picture here, chorioretinitis, which is inflammation of the choroid in the eye. This is a picture of what that can look like, and intracranial calcifications. These can be seen on imaging of the newborn baby. They are also often seen on prenatal ultrasound imaging, and that can be a tip-off that the baby may have been exposed to Toxoplasma gondii. Now, if the baby is born and initially appears normal, unfortunately, that baby's at risk for long-term sequelae, and one of the major long-term sequelae is blindness because of the retinitis that can develop. The baby's also at risk for seizures and other central nervous system manifestations because this infection often infects the intracranial structures. Next, let's talk about syphilis, which is caused by infection with Treponema pallidum, which is a spirochete, a special form of bacteria with a corkscrew shape like what's shown on the screen here. Treponema is transmitted by sexual contact, and the symptoms in the mother during pregnancy are the same as the usual symptoms in an infected person, which I talk about in the infectious disease section. So in primary syphilis, the woman may develop a chancre, and in secondary syphilis, she may develop a maculopapular rash, which classically involves the palms and soles. And if she's not treated, the infection can be transmitted to the baby in the womb, and the baby can be born with findings that occur either early on before 2 years of age or later in life after 2 years of age. There are a number of symptoms that babies can have in the first 2 years of life if they have developed a congenital infection with syphilis, but the three that I recommend you remember so you can recognize this disorder in a board question are first a maculopapular rash, which as you know is one of the symptoms of secondary syphilis infection even in adults. The second one is a runny nose. These babies have severe runny noses caused by active replication of the virus, and that's something that usually will stand out in a board question. And then finally, they often develop abnormal long bones. So the bones don't grow normally if this infection is present. This is more common in the legs, and there are many, many abnormalities reported. You can read about all of them if you wish, but if they describe any sort of abnormal bones of the legs along with these other two symptoms here, that's usually enough so you can recognize a case of congenital syphilis. In the modern era, most mothers and babies with syphilis are treated, but decades ago when there was no treatment for syphilis, babies born with congenital syphilis infection would grow up to develop permanent deformities related to the in utero infection. These were called the late findings of syphilis that usually developed in children greater than 2 years of age. So first of all, these children would have abnormal ears and nose. The classic nose finding was called a saddle nose deformity where there was no nasal bridge. And then in terms of the ears, these children often had hearing loss and deafness. There were a couple of classic findings in the teeth of children with congenital syphilis infection. The first one was called the presence of Hutchinson teeth. These are notch peg-shaped teeth. This is an example shown on the screen here. If you look closely, this person's teeth have a notch missing from them and they are peg-shaped. These are called Hutchinson teeth. The other classic finding was called mulberry molars. These were molars that had bumps to them and looked like a mulberry, as shown on the screen here. You could see this when you examined the back teeth of a child with congenital syphilis. And then finally, these children would have abnormal legs. The finding was called a saber shin, which were bowed legs. And all of these findings were caused by scarring and gumma formation related to the in utero infection. Next, let's talk about the varicella-zoster virus, which is a herpes virus, a DNA virus. Maternal primary infection with this virus can cause chickenpox, and if the mother has a latent infection that reactivates, that can cause herpes zoster or shingles. And if the mother develops a primary infection during the first trimester of pregnancy, that is what can be passed to the fetus and cause fetal infection. If the mother develops primary infection in the first trimester and passes it to the baby can be born with some of the signs and symptoms shown on the slide here. First of all, the baby may have scars in a dermatomal pattern. You may know that herpes zoster causes shingles, which creates a rash in a dermatomal pattern, and similarly, the scars in the newborn baby may follow the dermatomes. There are a number of CNS abnormalities that can be seen. These can include microcephaly, hydrocephalus, or seizures. There are also eye abnormalities that can occur, like cataracts and nystagmus. And then finally, the limbs can be very small. They can be atrophied or hypoplastic. But the major issue with this virus, if it occurs during pregnancy, is the long-term effect. These children will have permanent central nervous system dysfunction. This can lead to learning disabilities and mental retardation. Next, let's talk about parvovirus B19. This is a non-enveloped single-stranded DNA virus. The virus is found in the respiratory secretions of infected persons and transmitted to other individuals, including potentially pregnant women. The classic infection caused by this virus occurs in children. It's called Fifth's disease, and it presents as a slapped cheek appearance of the face, like this child shown on the screen here. Adults who get infected with parvovirus classically develop arthritis, often involving the hands, wrists, knees, and ankles. And what you need to know about this virus is that it infects red cell progenitors, so it causes a mild anemia in normal individuals that is usually asymptomatic. If it infects an individual with a chronic anemia, like sickle cell anemia, it can lead to an anemic crisis. If a mother who's infected develops a parvovirus infection, the fetus is especially vulnerable for a couple of reasons. Basically, babies in the womb depend heavily on their red cell progenitor cells, and they cannot tolerate having those cells infected by parvovirus. The reasons for these include that the fetal red blood cells have a shorter half-life compared to normal. In addition, the baby is growing, so it constantly needs to expand its red blood cell volume. And then finally, the baby has an immature immune system, so it's less able to fight off the parvovirus infection. So for all of these reasons, if a mother develops an infection, this will often lead to miscarriage or fetal death, as is the case with many of the torch infections. But beyond those things, the feared outcome of a parvovirus infection in utero is called hydrops fetalis. This is what happens anytime a baby in utero develops severe anemia. There will be fluid accumulation in many tissue beds in the fetus. The baby can become swollen. This is a picture of what it looks like on the screen here. In addition, the baby can develop ascites and pleural effusions. This is often diagnosed prenatally via ultrasound, and like I said before, this happens anytime a baby becomes severely anemic. There is one form called immune hydrops, which happens when there's an Rh mismatch between the mother and the mother's antibodies attack the baby's red blood cells. Then there are many non-immune causes of hydrops fetalis, and parvovirus B19 infection is one of them. Moving on, let's talk about rubella. Rubella is an RNA virus. It is found in the nasal and throat secretions of infected persons, and a mother who is pregnant can get infected via respiratory droplets from an infected person. In the mother, it usually causes a mild self-limited illness that includes a maculopapular rash, lymphadenopathy, and joint pain, and this is a picture of what the maculopapular rash can look like. In the baby, however, this can lead to the baby being born with the congenital rubella syndrome. This is largely historical in the United States nowadays because of vaccinations, but years ago, when there were no vaccinations for rubella, this is what could happen if a mother got infected when she was pregnant. So babies with the congenital rubella syndrome would be born with sensory neural deafness. They would classically have cataracts, and then they would have a number of congenital heart malformations. The classic congenital heart malformation was a patent ductus arteriosus, or a PDA, which I talk about in the cardiology section. And then finally, these babies would have a blue discoloration of their skin that was called a blueberry muffin baby. So a blueberry muffin baby was the term used to describe children born with purpuric skin lesions all over their body that looked like these dark purple spots. This is an example of a baby with a blueberry muffin rash shown on the screen here. The cause of this problem is extramedullary hematopoiesis. So what do I mean by that? So hematopoiesis is the generation of blood cells, and normally this occurs in the bone marrow, but in utero it can occur outside the bone marrow. That's called extramedullary hematopoiesis, and one of the places it can occur in utero is in the skin. Now normally this stops before birth, but in babies born with certain congenital infections it will persist after birth and cause the blueberry muffin rash. And one of the classic congenital infections to cause this blueberry muffin baby syndrome is a congenital rubella infection. You can also see it in congenital toxoplasmosis and CMV, but rubella is the classic infection to cause the blueberry muffin rash. Next, let's talk about cytomegalovirus, or CMV. This is also a DNA herpes virus, just like varicella. There are several modes by which a mother can get infected. First of all, she could get infected from sexual contact, but what is more commonly the case for pregnant women is that they become infected by close contact with someone else who's infected. This could be a family member, but a classic way is if a mother is exposed to children who go to daycare. Many children spread this around at daycare, and that's a way a pregnant mother could become infected. And then finally, you can become infected with CMV by blood or tissue exposure, like through a transfusion or an organ transplantation. Now, a primary infection with CMV is usually asymptomatic in 90% of cases. If it does cause symptoms, it's usually very nonspecific. It's a mild febrile illness. It's sometimes described as mononucleosis-like because it resembles mono, and the symptoms are nonspecific, like all of these items I've listed on the slide here. Most infected newborn babies are asymptomatic, and the thing you want to always remember about congenital CMV infection is that the major consequence is sensory neural hearing loss. Even if a baby is born with no symptoms of infection, there's about a 10% chance that baby will have hearing loss. If the baby does have symptoms at birth, the risk of hearing loss is up to 50%. This is the most common consequence of congenital CMV infection, and because most babies are asymptomatic, they're often diagnosed with the CMV infection based on a failed hearing screen. At that point in time, blood testing is done, which reveals the infection, and this is the most common infectious disease cause of congenital sensory neural deafness. As I said before, most babies are born with no obvious evidence of infection, but if there is evidence of infection at birth, some of the potential findings are shown on the screen here. First of all, the baby may be small for gestational age and may have an underdeveloped head. There may be an enlarged liver or spleen. CMV is one of the causes of blueberry muffin baby, although rubella infection is the classic cause. And then finally, the baby may develop seizures shortly after birth. The classic finding on neuroimaging is shown on the screen here: intracranial calcifications around the ventricles, so-called periventricular calcifications. It's shown in this picture here, and that's the classic finding of a congenital CMV infection. Now let's talk about herpes simplex infection. Herpes simplex virus 2 is a DNA virus that infects the genitals. In women, it causes vesicles of the vagina, like is shown in this picture here. And if a woman has this infection active in her vagina at the time of birth and has a vaginal birth, the baby can become infected from passing through the vaginal canal. So just a key note here, this is not a transplacental infection. These other torch infections we've discussed get to the baby by crossing the placenta. In this case, the baby is infected by traveling through the vagina of an infected mother. The first thing that can happen to the baby is that the baby can develop vesicles, much like what is present in the genitals of the mother. These can occur in the skin of the baby, sometimes near the eyes or even in the mouth. And what's even more dangerous than the skin findings is that the viral infection can spread to the central nervous system and disseminate to multiple other organs. So for this reason, women who have active herpes genital lesions at the time of delivery are often offered a C-section so that the baby doesn't have to pass through the vaginal canal. And that concludes our video on the torch infections.